Epilepsy was originally known in mythical pathology as falling sickness and is a characteristic that is the most recognizable in epilepsy. They usually have a sensation felt before the seizure happens. They also involve convulsions and spasms. Convulsions are a result of a sudden relief of nerve impulses in the motor cortex of the two hemispheres, and a spasm begins in one region of the body, such as the face or the arm, and then spreads to other parts of the body on the same side. There are two different kinds of seizures. One is major and one is minor. The major symptoms include prolonged unconsciousness and severe, rigid, and violent muscle spasms that leave the body in a weird position and fall to the ground, which is the most recognizable sign of having a seizure. Head and eyes fall to one side and involves all muscles. Facial features are distorted and the person is pale. The eyes are open or closed and pupils are dilated. Movements from the chest occur because the air is leaving the thorax, saliva is coming out of the mouth. There will also be a remission with deeper muscular contractions where there are many different kinds of seizures. The first one is an absence seizure. An absence seizure, previously known as a Piedl-Mal seizure, often occur in children and are characterized by staring into space or subtle body movements such as eye blinking and lip smacking. These seizures may occur in clusters and cause brief loss of awareness. A tonic seizure is when your muscles stiffen. These seizures usually affect the muscles in your back, arms, and legs and may cause you to fall to the ground. An atonic seizure is also known as a drop seizure, which is a loss of muscle control which may cause you to suddenly collapse or fall down to the ground.
Epilepsy is typically diagnosed as one who has had more than one seizure. A seizure is caused when a burst of electrical impulses within the brain overload, which can be transmitted to the muscles, causing the well-known uncontrollable convulsions. There are several different factors that can cause these seizures. However, about half the people suffering from epilepsy have zero identifiable causes. The other half suffer from a variety of causes including genetics, head trauma, brain conditions, infectious diseases, prenatal injuries, and developmental disorders. Due to the fact that half of the victims of epilepsy have none of these known causes, it has been difficult to properly diagnose and treat. Genetics. Scientists have discovered links between the part of the brain that's affected by seizures and how certain genes may make one more susceptible to seizures. However, genetics are never the only cause of epilepsy. Head trauma. Severe head trauma such as falling from a high distance can be a cause of epilepsy. Brain conditions. Brain tumors, strokes, and other medical conditions that harm the brain can cause epilepsy. In fact, strokes are the leading cause of epilepsy in adults over the age of 35. Infectious diseases. Meningitis, AIDS, and other infectious diseases have been known to cause epilepsy. Prenatal injuries. Brain damage suffered before birth from a variety of causes can also be known to cause epilepsy. And in developmental disorders, it can be linked with such mental disorders such as autism or others.
So the different ways that doctors diagnose epilepsy are by doing neurological exams, different kinds of blood work, but also scans like an EEG, a CT, or functional MRI. These are really just diagnostic tools in helping doctors determine what kind of seizures the patient's having, where the seizures are happening, or things that might cause them. Usually the most simple and common treatment for epilepsy is the use of anti-epileptic drugs. These drugs help control the electrical impulses that are the actual cause of the seizures, no matter where the seizure is happening in the body. Just like most regulatory drugs, AEDs work the best if you take them at the same time every day, but also continue to take them as prescribed so that your body can get used to them. It can get used to the chemicals that you're putting into your body. If AEDs don't work or the doctors can't determine the cause of your seizures, where they're coming from, things like that, something that they might turn towards is a hemispherectomy. And that's actually the removal of half of the brain. There are two kinds of hemispherectomies, a functional, which is basically just a disconnection of everything that connects one side of the brain to the other side, or an anatomical, which actually is the removal of a whole side of the brain. They leave the basal ganglia, the brain stem, and other things that are, vital for the function of the brain.
There are many economic impacts of epilepsy. There are certain laws, regulations, and rules that prevent employers from having any prejudice to people with epilepsy or other disabilities. Unfortunately, this isn't often the case. Sometimes employers will be less likely to hire those with epilepsy because they might not be able to perform their job to their fullest capability and might miss work more often due to medical appointments or other reasons. People with epilepsy are more often likely to be unemployed compared to people who have normal health. Some societal and social impacts of epilepsy include people who work and go to school. Students with epilepsy are often given longer times to complete exams or projects and can receive additional help from teachers. Some more societal impacts of epilepsy include support groups. Especially now with the internet, people can meet others with epilepsy and talk to them and commiserate about their and people with epilepsy can find others who struggle with the same disorder and can commiserate about what they go through and the different struggles they have to face in their day-to-day lives. There are a lot of safety procedures taking place to protect those with epilepsy. These can include anything such as service dogs to bracelets. Many service dogs are able to detect when people are about to have a seizure and can get under them to protect them from falling or having any permanent head trauma or other severe injuries. Also, people with epilepsy can wear bracelets that notify strangers and others that they have epilepsy and what to do if a seizure ever occurs. Epilepsy also affects many college students. For college students, this can affect a lot of their life, but there are many procedures and other protocols taken to make sure they live just like any other normal college student. When sleeping, college students with epilepsy should avoid bunking their beds or lofting them in case they have a seizure or fall in the middle of their night. Their fall and injury will be less severe because they'll be closer to the ground. Also, alcohol can affect one's medications if they have epilepsy, but research has not shown any negative effects of drinking alcohol if you have epilepsy.